Several million Americans have atrial fibrillation or AFib, and some estimate up to 12 million will have it by 2030. Today we have with us nationally renowned electrophysiologist and leading authority on AFib, Dr. Eric Prystowski, who will, in this Heart Health series, explain to us just what AFib is, what is actually going on in the heart, and the different treatments that are available to manage it. Dr. Prystowski, thank you so much for being with us.
It's my pleasure to be here. Thank you.
Can you tell us a little bit about your specialty?
Sure. And by the way, just to make life easy for you, you can call me Dr. P like most of the world does. Electrophysiologists are super specialists, cardiologists with extra training in the care of patients with arrhythmias. What I often tell my patients, Lindsay, is that I'm the friendly electrician of your heart. People know about the plumbers. Those are the people who go in and take care of coronary artery disease. But electrophysiologists are responsible for figuring out heart rhythm problems and the treatment of them.
Probably the most important question is, why is atrial fibrillation and knowing about it so important?
That's a great question, Lindsay. Atrial fibrillation, or AFib, is a heart rhythm disorder that affects the upper chambers of the heart, called the atria. Several million patients in the United States and many more worldwide have it. It can present without any symptoms or cause major problems, including heart failure and stroke.
Can you tell us a little bit about the normal electrical rhythm of the heart?
Certainly. Give it my best. I think one way to look at this is to compare the heart to a house. Both of them have walls, plumbing, and electricity. Note from the diagram of the heart that there are two upstairs chambers, and they're called the right and left atria, and there are two bottom chambers, and they're called the right and left ventricle. The illustration of the house shows two rooms upstairs and two rooms downstairs. Then the heart has its own native pacemaker that's called the sinoatrial node, and electrical impulses originating in this structure flow from the right to the left upper chambers and then through a conduction system down to the bottom chambers of the heart. The bottom chambers of the heart are the pumping chambers, and they allow blood flow to go throughout the body. The electrical impulses from the top of the heart get to the bottom of the heart through a conduction system, a key part of which is called the atrioventricular node. Now, if you look at the model of the house, imagine you're a person starting to walk from the top of the house down the stairs that can branch either to one room downstairs or the other side of the house. And it's very analogous to the conduction system in the heart. What you can see in the animation is the heart, not the house, with the same sinoatrial node, which is the pacemaker. You'll see the conduction system coming down, and you'll see the start of the activation on the top with the electrical system. Once that activates the top chambers, they will start to pump, and then the flow of electricity goes through the conducting system, reaches the bottom, and then it pumps. The top chambers pump, the electricity goes to the bottom, and the bottom chambers pump. This basically is the function of the heart. The heart is a pump, and the electrical system allows an orderly flow of activation to the pump that is the most optimum for patients to get adequate cardiac output of blood through the heart.
Just amazing to watch that in action. Now, many of us have had an ECG. What exactly is that?
Yes, the electrical activity of the heart can be demonstrated graphically when one has an electrocardiogram, or shortened to ECG. During this process, a patient, as seen in the figure, is lying on a table, and 12 leads are connected to different parts of the chest and rest of the body. Those will pick up the electrical signals from different parts of the heart. Now, these electrical signals will be transcribed onto paper, and this is what is called the electrocardiogram, or ECG. During normal rhythm, meaning that the heart is being activated by the normal pacemaker of the heart, there will be several specific parts of the tracing that are important to evaluate. Now, the P wave represents the activation of those two top chambers of the heart. And after the P wave, there's a silent period, a quiet period, because that's when the electrical impulses will go through the conducting system. And the electrical activity from the conducting system isn't strong enough to be actually seen on the chest wall and be transcribed on the paper. Then there is what's called an R wave, and that represents the electrical activation of the bottom chambers of the heart. And then when the heart actually relaxes, it gives another wave, and that's called the T wave.
So what's the difference between an ECG and a rhythm strip?
That's a terrific question because they often get confused. The ECG is broken up into 12 sections because they represent evaluation of different views of the heart, since you have these different leads on the chest. It's like looking at a house from 12 different locations, and each area you look from will have a different look to it, but when you look at them all together, you get a better look at the entire house. Lindsay, so what's the difference now between the 12-lead electrocardiogram and a rhythm strip? And this is important because patients often hear about these two things. A rhythm strip is often what's recorded from only one or two leads on the heart. In this instance, you can see the rhythm of the heart quite well, but you're not going to be able to analyze the entire electrical flow through the heart. Monitors that patients wear sometimes for days or weeks usually record this kind of information.
That really helps clear things up, and as we'll learn in the next segment, there is still so much to learn about AFib.